Good evening, everyone. I'm Varsha Shrivastava from Bladder Wellness Team. I hope you are keeping safe. Please vaccinate yourself and wear a mask when in a public place. Today, we are here to discuss about prostate gland. Prostate gland is an organ of the male reproductive system. Around 25% of men aged 55 years and over have a prostate condition. This increases to 50% by the age of 70 years. So, in this week, let's unite to raise awareness about the issues related to prostate and its impact in the life of people living with it. To throw more light on the subject and guide us on what's right for the diagnosis and treatment of prostate related diseases, today we have with us Dr. Sudhir Chadha, sir. It gives me an immense pleasure to introduce Dr. Sudhir Chadha, sir, to you all. Sir is the co-chairman of Department of Urology at Sir Ganga Ram Hospital, New Delhi. Sir has a rich experience in the field of urology and carries out the treatment with utmost precision and efficiency, ensuring that the patient's health is in safe hands. Sir, it is a pleasure to have you in our show. We welcome you.
Thank you for a very kind introduction.
So, sir, there are many things that our viewers would like to know. So, first, let's start with the meaning of prostate. What is prostate actually?
See, prostate is a gland in the male urogenital tract at the beginning of the male urethra at the junction of bladder and the urethra. Its main function is to protect the upper urinary tracts from the infections coming from the lower urinary tract. And by the time one crosses into the puberty and above age group, it starts getting enlarged in its size. And sometimes, as you just told us in the introduction, it obstructs the urinary bladder outflow or sometimes irritates the urinary bladder. So there can be two types of problems with the prostate, either due to obstruction, which can lead to poor flow, straining, sense of incomplete evacuation of urinary bladder, dribbling, or delay in starting the urinary tract, or symptoms can be due to irritation of the urinary bladder, like increase in frequency of urination, urgency, which means person not able to hold on to the urine, he just has to rush to pass urine, or sometimes patient are just not able to control and they just leak on the urge, which is called urge incontinence. These are two types of problems which can primarily be caused by the prostate, either due to obstruction, which are called obstructive seizures, or due to irritation of the urinary bladder, which are called irritative symptoms. And sometimes in a few patients, there is a combination of the two. They can have obstructive features also, they can have irritative features also. So, person varies from person to person, in which person, which symptom will predominate, or sometimes they can alternate, or sometimes they can be together.
Okay. So, sir, at what age does this problem occurs?
Usually, we recommend a person above the age group of 50 years to come to us once a year for the checkup of the prostate. So by the age of 50 years, almost 20 to 30% of people will have some degree of the prostatism. Prostatism means symptoms related to the prostate. And we definitely recommend, in fact, in our hospital executive health program, there's a protocol for all the people who are above the age group of 50 years to have the prostate checkup done. And which is basically very simple checkup. What we have to do is one urine examination, one PSA examination, one ultrasound, and one manual digital examination of the prostate. That is it. And it takes hardly an hour or so for the person to get it checked.
Okay. So, sir, after how many hours or days the person can expect to get the reports that have been conducted?
Nowadays, the reports are available on the same day. Ultrasound, uroflowmetry, urine test, they are available almost hand to hand.
Hmm.
And urine examination and PSA, they take around hour or so reports to be ready. I think in 1 or 2 to 3 hours maximum, person will be evaluated for the prostate if there is any problem there or not, and if it is there, what it is.
So this is a good part actually that the tests which are conducted, the patient can get the report in within the same day itself. They won't have to wait for long.
Sure, that is correct.
Yes. Okay, sir. So, sir, what are the early signs or symptoms that the person can experience if he is getting prostate?
The commonest feature is decrease in the flow of the stream of the urination. Yes, धार हमारी कमजोर हो गई. We are not able to start the urination. We have to wait for the urine to start. These are the commonest early symptoms in the people.
Okay.
And sometimes it can be added on with yes, हम रात को ज्यादा उठते हैं, दिन में बारी बारी पेशाब करने जाना पड़ता है. That's it. These are the common early symptoms.
So, if you are experiencing any such symptoms, then it can be a sign of prostate. So, it's the right time for you to consult the urologist and get the right treatment at the right time. Okay. So, sir, many a times it happens that people they tend to just ignore such kind of a symptoms and then they don't take any proper treatment for that. Can this disease can go on its own or a proper treatment is must?
See, prostate is a disease are phasic. They increase or decrease on their own. As such, if prostate is there, it will not go away. But prostate has got two components, dynamic component and static component. Dynamic component varies from season to season, from mood of the patient, from constipation, how much water or how much diet he is taking, whereas static component is same. So dynamic component changes. And people think that they are experiencing increase or decrease in the symptoms of the prostate. Oh, मैंने देसी दवाई खा ली थी, मैं ठीक हो गया. मैंने कुछ हकीम जी की दवाई खाया था, मैं उससे बेटर हो गया. मैंने फलाने डॉक्टर के पास गया था. It is not that prostate is getting cured. It is that symptoms are getting increase or decrease along with their dynamic component. So if prostate is there, it has to be taken care of either most of the time medically or sometimes surgically. Nowadays we got a lot of newer medication which can treat the prostate very, very effectively. In our practice, surgery for the prostate in last 5 years had decreased by 30 to 40% because we got so much effective medications for the prostate.
Okay. So there is no need to ignore such kind of symptom. The right way is to get the treatment at the right time. Okay. So, sir, suppose the person has gone to the doctor and now through the test has got to know that he is suffering from prostate. So, is this disease curable through medication or one has to go for the surgery only?
I just told you, nowadays we got so much effective medications that in our surgical practice, prostate surgery has gone down by 30 to 40% last 5 years. Medicines are very, very effective. And there are indications for surgery, strong indications, moderate indications, or mild indications. What are the strong indications for the surgery? Strongest possible indications for the surgery are if there are infections in the urine, if our kidneys are getting affected because of the back pressure changes due to ignoring the disease or the early symptoms, or patient is passing blood with the urine. These are the strongest possible indications for the surgical intervention. What are the moderate indications? Symptoms which are not amenable to the medical treatment. Patient is not able to control his dietary habits. Patients are immature or irresponsible. What are the mild indications? कि हाँ जी मेरे को प्रोस्टेट है, मैं इंडिया से बाहर जा रहा हूँ, आपसे दूर हो जाऊंगा. These are the mild indications. So we have to take care of strong indications. If there are strong indications, definitely surgery is the answer. But as I told you, with the advancement of science and technology, surgery is also very, very safe. And that is also done in most of the time in daycare basis. That is, the patient comes here, gets the prostate operation in the morning.
So you're mute.
That is, I was just telling you that surgery is also very, very safe. if surgery has to be done or it is indicated, most of the time it is done on a daycare basis. We don't even admit the patients in the hospital. They come straight away to the operation theater, get it done, go home in the evening or early morning next day.
So even in the operation, the patient won't have to wait for long.
Just hold on for a second. Hold on for a second. Volume kar de. Hello?
Yes, sir.
Just excuse me, that is some problem is there. Hello?
Yes, sir. Am I audible?
Yeah, now it is.
Am I audible right now?
Yeah, now you are.
Okay, sir. So here we got to know a very important part, that if the patient is going for the operation, within the same day, the patient will get discharged. Okay.
Oh, it is, you're not audible again. Just hold on for a second. आवाज खत्म हो गई थी.
Yes, sir.
Full है. Okay. Full है, sir. Full है. Yeah. Hello.
Yes, sir.
Now you're slightly better.
Am I audible right now, sir?
Yes. I have to strain a little. Just hold on for a second.
Okay, sir.
Yeah, now better. Yes.
Now it's fine.
इसमें चल रहा है. हाँ.
Okay. So we were discussing about the operation, about the surgery. So it's for all the viewers that once you're going for the surgery, sir has just now told that you will be discharged within the same day itself. You will not have to wait for long. Okay, so sir, let's discuss about the medication part. If the patient is taking the medicine, and after how many days we can expect to see the changes or in the patient? Like how long we'll have to take the medicine?
See, medicine. See, prostate is a condition, not to go away. It is managed. You understand the treatment of cure and the management of the disease. We are managing the prostate. In managing the prostate, if patient is improving with the medications, improvement is visible within 2 to 3 days. And if improvement is there, patient has to continue the medication till they are effective. Till they are effective. And for some reason, some patient becomes refractory to a group of medications, then we can change the medication to another group. We can change the group of the medications and hope that patient will keep on responding to the medication. Rarely, patient progresses in the cases in which medicine is not effective. Only then surgery is indicated.
Yes, that's there. So, sir, any medicine which is taken for any kind of a disease, there are always some or the other side effects related to the medicine. So, sir, what are the side effects of the medicine that is given for the treatment of prostate?
There are two significant group of side effects of the prostatic medication. One is related to the blood pressure. That sometimes it can cause the postural fall of the blood pressure. So patients have to be careful about getting up from the bed, about sudden movements from the bed. And other group of side effect is that at the time of physical relationship, they can have the feeling of not ejaculating the semen. In what happens, that semen goes back to the bladder because bladder is open because of the medication. It goes back to the bladder, it comes out mixed with the urine. So this is called retrograde ejaculation. So two group of side effects, main side effects are there: retrograde ejaculation and sometimes postural hypotension, which is called. Rarely dry mouth, sweating. These are side effects which can happen. But mainly two type of side effects are there: sudden fall in blood pressure with a change of posture, or difficulty or not having adequate ejaculation at a time of physical relationship.
Okay. So yes, there are side effects of the medicine that are given for the treatment of prostate, but still there is nothing to worry. There is also a cure for the medication if you will follow all the things that are told to you by the urologist. So for all the viewers, please follow every step carefully. Okay, so sir, let's discuss about the surgical part now. So as you have told that the patient will be discharged within the same day. So after surgery, post-surgery, what and all things the patient need to take care of?
We are able to discharge the patient same day or early next day morning because of the change and style of the communication with the hospital and the doctors. Nowadays, patients are constantly in touch with their urologist or the hospital, and in some cases, both the things. Patients have to take care that their catheter, which is there for few days, it is draining very well. There is no blood in the urine, or they should not be having any fever. These are the three things which the patients have to be careful, and they are adequately briefed when they are discharged from the hospital. They have to take care of the catheter, number one. They have to make sure that they are not having profuse bleeding in the catheter, or they should not have a rise in the temperature. If these three things are there, they should immediately contact the urologist or the hospital to get the treatment for this.
And sir, after how many days the patient can get back to his normal life and start doing all the normal physical activity?
I think around a week or so, which what I advise the patients.
So after a week, the patient can get back to his normal life. But as sir has just now told that the permission is essential. Ask the urologist, and as and when you're getting the permission, then you can get back to your normal life. Okay, so sir, after the surgery has been done, are there any exercises that is advisable for the patient to do in his daily life?
He can do any normal exercise. The only precaution he has to take is not to strain too much, no heavy work, no heavy weightlifting. That's the only things which are prohibited. He can do whatever he feels like.
Okay. And so once the surgery is done, is there any chance for the prostate-related problem to reoccur?
Oh, yes. See, there is one thing called possibility. The other thing is called probability. Possibility of recurrences is always there, but in our practices, it is hardly less than 3 to 4%. And because there is a long passage of the urinary tract, which is called urethra, one can have some difficulty due to stricture formation, rarely due to regrowth, sometimes due to infections. They can occur. But probability of these things is less than 2 to 3%. You cannot equate possibility with the probability. They are two different things altogether.
Yes, that's there.
And the other thing in the post-operative patient has to be careful is that they should definitely follow it up with the biopsy or histopathological examination of the tissue which has been removed. Because CA prostate, cancer of the prostate is a disease which is slightly more dreaded than the simple prostate itself. And we, as a matter of routine protocol, we always send the tissue for the pathological examination so that when the patient comes for follow-up, we have the report ready.
Okay. So, yes, it can reoccur. It all depends on how careful you are. But the best thing is, in most of the cases, the problem is cured and there's nothing to worry. So, sir, how we can say that how successful is the treatment or the surgery is for the patient? Is it 100% successful, or in few cases the patient still have to suffer from prostate?
See, 100%, nothing is 100% in the world. Except in mathematics, 100%, 100% is there. But prostate surgery is successful to the tune of 98 to 99%.
This is good, actually, that the proper treatment will be provided to the patient. And so here comes another important question. What happens that, as we all know, that patient tends to ignore the symptoms. So what happens if they are ignoring it for a very long period of time and not taking the treatment at all for prostate?
If the patient ignores the prostatic symptoms, what happens? Patient starts storing urine in the urinary bladder, which in turn affects the kidneys and which in turn can lead to the chronic kidney disease or chronic kidney failure. Or sometimes the patient can lead to infection, that stored urine gets infected and can lead to sepsis or septicemia or pyocystis. These are two main problems which can happen if person ignores kidney failure or repeated infections in the urinary tract. And these are too much more dread complications than they are with a person without prostate.
Okay. So any which way, like the proper treatment is required if you want to avoid any kind of serious things that are going to occur in the future. So, sir, let's take few questions that we have got from our live viewers. So, the first one is, sir, how can we know if prostate cancer will grow rapidly or not? This is the question asked by our live viewer, sir. Phoebe Jen.
Prostatic cancer is one of the commonest cancer of males nowadays. And once the patient comes for us in the initial first examination, patient is asked to get the PSA examination done, followed by ultrasound of the genitourinary tract and specialized ultrasound for the prostate, which is called transrectal ultrasound for the prostate. If any of these things are suspicious, that is your digital examination of the prostate, ultrasound or PSA is raised beyond its normal limits, we start thinking or having doubts in our mind, yes, patient can have a CA or carcinoma of the prostate. Now, once we suspect that carcinoma of prostate is there, we definitely, patient is asked to undergo the biopsy or take a small tissue from the prostate for examination, which nowadays is usually done in the guidance of ultrasound or MRI or something, both the things. And biopsy is 100% diagnostic of the cancer of the prostate. And biopsy shows different grades. This is called Gleason scoring. And more the Gleason scoring is, more riskier or more high risk is the prostate. Lesser the Gleason scoring, lesser risky is the prostate. So if a patient suspects or a doctor urologist suspects with three things, with his digital examination, with the ultrasound examination, or with PSA examination, doctor suspects that patient is having or suspicion of having CA prostate, one should go on and get the biopsy done. And if person is able to get his prostate cancer diagnosed in earlier stages, nowadays treatments are available which can lead to definitive cure of the disease. And supposing a patient forms or has a disease which is localized to the prostate, almost 100% cure is there, either due to surgery or to radiotherapy or to hormonal treatment, whatever patient decides to get it done. And sometimes the patient comes to us with high-grade disease or disease spread to the body or all over the body, yes, it can sometimes be difficult to control. And it all depends upon the Gleason scoring, age of the patient, health of the patient, general health of the well-being of the patient, what course do we do? And for every patient, treatment is tailor-made for the patient, depending upon his Gleason scoring, localized or spread of the disease, age of the patient, and general well-being or health of the patient.
So, sir, what is the difference between BPH and prostate cancer?
Oh, world of difference? World of difference? That is, BPH is a benign disease, cancer is a malignant disease. BPH patient difficult to die, with a cancer patient will surely die.
Okay. So,
The
sir,
world of difference?
Yes, of course. So, sir, we can say that the diseases related to prostate, are these life-threatening?
Life-threatening if ignored.
Okay.
Any disease can be life-threatening if ignored.
Yes. So the proper treatment is needed at the right time.
If proper treatment is done and diagnosed at early stages, definitely it is 100% curable.
Definitely. So at the right time, the proper treatment is required. Then you can get rid from this problem. In most of the cases, as sir has just now told, that this problem is treatable. So there is nothing to worry about it. Okay. Yes, sir.
Absolutely right.
Yes. So, sir, is this problem related to prostate? Is this genetic, or anyone, like any male member at any given point of time, once he crosses the age of 50, will get prostate?
Prostatic problems are multifactorial. As it is highly prevalent disease, almost 50 to 60% of the people above the age of 50 years or 70 years will get this. So genetics plays part of it. we cannot solely blame the genetics for this.
Okay. So, like this problem can occur after the age of 50. So, this is, like, we can say, a very common problem in male.
It is common. It is common problem. Yes, of course, it is common problem. That is why only because the prostate urology came as a special subspecialty of the surgery. It is so common. In my any given day in my OPD practice, I see around 5 to 6 patients. If I see 30 patients in a day, 10 are having prostate problems.
Okay. And sir, can we, like the male members, can they do anything to prevent themselves from getting this problem, or they will have to go through this?
See, these are the things which cannot be prevented. They can be diagnosed at the earliest stage. There is no such thing as prevention for the prostate. No, you cannot do it. Nobody can do it to prevent the problem. It has to occur. It has to occur.
And let's come towards the dieting plan and everything, because diet is very important and the person is having a healthy lifestyle. And it is believed that he will stay away from all the diseases for a very long period of time. So what are the things that the patient or the person can involve in his diet so that he can get safe or get rid from the problem?
Yes. There is a very big misconception in the general population that if they are having prostate, they should take a lot of fluids. This in fact compounds the problem. If a person starts having prostatism, he starts taking a lot of fluids, he will start making a lot of urine. As I told you, prostate is there on the way of the urinary tract and he is not able to pass urine comfortably. It compounds the problem. If person has frequency, he will have more frequency. If patient is having uncomfortable while passing urine, he will be more comfortable. So water intake should be as per desire. One should never force the water, especially if the person is having some degree of prostatism. Normal intake of the water should be there. Other thing is, a lot of people take in the prostatism tea, coffee, and cola drinks. These are things which increase the production of the urine in the body, and they cause instability of the bladder also. If the person is having some degree of prostatism, he should try to avoid cola drinks, tea, or excessive tea and coffee intake. The other thing a person can do is avoid the constipation. Constipation, like we all know, causes a lot of problems to the persons. And if person's rectum is loaded or overloaded with the fecal matter, it compounds the prostatism. So 2 things person can do is avoid the constipation, avoid tea, coffee, and cola drinks, and take water in moderation.
All these things are very essential and it must be followed by everyone. Okay, so sir, here comes another question and it is from Adi Jain and it is related to diet only. So he is asking, what is the best fruit that can be taken for prostate?
Prostate, in fact, is an alkaline gland. So the fruits which are rich in vitamin C, they are helpful or healthy for the prostate. Like guava, amrud acha hai hamare liye. Guava is good. Pomegranate, anar hamare liye acha hai for the prostate. And other fruit which is very healthy for the prostate is gooseberry or amla. These 2 fruits are generally speaking healthier for the prostate. All the fruits are good, but these fruits are more good for the prostate than other fruits. Guava, amrud, gooseberry, amla, and anar, pomegranate. These are 3 fruits which are healthier for the prostate.
And sir, are there any kind of things that the person needs to avoid in eating, like in his diet, that may lead or increase the prostate?
I just told you.
Apart from the drink,
tea, coffee, cola drinks, chocolates, these cause the increase in the problem with the prostatism.
So it is also believed that the patient is taking non-veg items or even like red meats, so it will lead to many kind of problems related to like continence also. There is
no direct correlation between vegetarian or non-vegetarian diet with the prostatism.
Okay.
He can take whatever meals comfortably.
Okay. So the best thing is, as in when the patient is getting any kind of symptoms, then is the right time to go and take the proper treatment. That is very much needed. So then only you can get the cure. Okay, so sir, let's once again discuss about the surgical part. suppose, sir, if the patient is very old and he is suffering from prostate, so obviously his body is not responding that much. So if and the surgery is very essential. So what is the thing that can be done for the proper treatment of the like old age patient?
Nowadays, surgery has become very, very safe with the advancement in all the techniques, advancement in anesthesia. Anesthesia has become much more safer, than around 30 years ago, and now there is a world of difference in anesthesia. There is a world of difference in the management of cardiac diseases, world of difference in the management of heart diseases, world of management treatment of diabetes and chest disease. These are things which a patient suffers in the old age.
Mm-hmm.
Nowadays, our anesthetists are very, very capable of taking care of all these things. And old age is never a surgical challenge. It is this challenge for the anesthesia. And they are very well now versed in tackling these old age problems. As our country gets healthier, as our country gets aged, more and more people will grow to the old age. And our anesthetists and our urologists, they are very well capable of tackling these problems.
Yes, sir. So let's take another question that we have got from our live viewer. And this is from Rohit. And so he's asking, how can we know if prostate cancer will grow rapidly or slowly, and how dangerous it can be for the person?
See, cancer is a cancer. If not treated, it will definitely kill the person. That is for sure. Cancer is a cancer. It will not treat, it will definitely kill the person. Now, how rapidly or slowly the prostate cancer will progress depends upon the biopsy. Younger the patient, worse is the outcome. Biopsy tells us lesser, as I told you, there are types of the prostate depending upon the Gleason scoring. Lesser the score, better the prognosis. More the score, worse is the prognosis, which means poorly differentiated carcinomas. Younger the people, younger the patient, worse is the prognosis. Elder the person, well differentiated the carcinoma, better is the prognosis.
This is there. And so this is the another question that we have got from our live viewer. And he's asking, so what is the latest treatment for BPH? We have got from our live viewer.
Latest, see, medical science is constantly evolving. It is not a static science.
Yes.
But still, the gold standard for the surgical treatment for the prostate, gold standard still remains the transurethral resection of the prostate, which is called TURP. But every day, like new car models, every day new laser comes and every company claims that his laser is better. So every day new laser machines come. Every day new molecules are being introduced in the market. Every day new pharma company comes with a new market, new molecule. Oh, our molecule is better. So there is no such thing as best treatment. For every patient, treatment is tailor-made according to his requirement.
Okay. I hope the question and the proper solution has been given, that the treatment, the latest treatment, whichever has come now, will give the proper solution to the problem.
So every day new laser model comes, like
Yes.
every day new car model comes.
Yes.
Every day new company comes with a new molecule. Oh, my molecule is better than your molecule. Yes. My car model is better than your car model. Nothing like that. There are standard requirements, standard treatments, standard parameters. And as I just told you, treatment is tailor-made to the patient.
Yes, definitely. Okay. And sir, as we have discussed that this problem occurs once the patient crosses the age of 50. So can we conclude that the people who are below the age of 50 will not suffer from this problem at all?
There is no such thing as never in the medical science. Earliest signs of prostatism have been diagnosed in the people as young as 39 years of age group. So if person is having symptoms, he should go and consult his urologist. There is no age bar for the prostate.
Okay. So here another important point we got to know that yes, the people who are below the age of 50 might also suffer from prostate related diseases, but there is nothing to worry. As in when you're finding any kind of symptoms, just go for the treatment and get the cure for the problem. Okay. And so what are the common misconceptions or the myths that are related to prostate that you would like to clear in this session?
Common misconception of the prostate is, yes, you take a lot of water, prostate will disappear. It never happens. Lot of water, in fact, compounds the prostatism. The other common misconception in the general population is that if you get the prostate surgery done, you will become impotent. It is nothing like that. People are very much apprehensive that prostate is done, they will have sexual deficiency, they have erectile dysfunction. It never happens. After the prostate surgery, patient will keep on having the sexual life as it was before. Sometimes ejaculation may get affected, except that there is nothing to do interfere with the erectile part of the patient life. These are two common misconceptions, that their potency will go or they will take a lot of water. Nothing like that. Prostate surgery does not at all interfere with the potency of the person.
Okay, so these are the we can say common misconceptions related to prostate that are cleared right now. This is for the viewers that there is nothing to worry about this particular problem. The best part is get the proper treatment at the right time and follow a proper diet as mentioned by sir, so you can get the proper treatment well on time. Okay, and so in the end, what are the different suggestions you would like to give to the people who are dealing with prostate, as a prostate not only hampers the physical life of the person but also mental stress is also generated because of it. So patients who are dealing with it not only physically but mentally as well, so what are the suggestions to such patients?
First suggestion is they should contact the urologist once a year. Number two is avoid tea, coffee, and cola drinks as much as possible. Number three is avoid the constipation. Number four is avoid self-medication. These are the four things.
Very important points that we got to know over here, that self-medication, that the patient, they try to become the doctor for themselves and they just ask their friends or relatives or just Google the symptoms and try to find the cure for themselves. So this is very risky. That should not be done. Proper treatment, if you need, please consult the urologist. So this, sir, the people who just Google the symptoms and take the medicine and think that they will get cured from this disease, how dangerous is this? Can you please elaborate it further?
See, Google is fountainhead of information. It does not necessarily make you knowledgeable. There is a great difference between information and knowledge. You cannot equate information with knowledge. They are two different things altogether. And sometimes the people equate information with the knowledge. It's never so. And if with some information, people start guessing or second guessing their symptoms, they become scared, they over-medicate, they under-medicate, and they try to avoid visiting their physicians. That is very, very dangerous. One should never equate information with the knowledge. They are two different things altogether.
Definitely. So here we got to know various points related to prostate, and I hope the proper concept and the proper solution is clear to all the viewers. I hope you have followed all the important points. So thank you so much, sir, once again for coming live and sharing all the important points related to prostate. It was indeed a very, very informative and helpful session for all our viewers. We look forward to many such live sessions from you, and I think that all the live viewers will follow all the important points and will keep a note of the important points that are mentioned over here in this live session. So once again, thank you so much, sir.
Thank you, Varsha. Thank you. Bye.
And thank you to all our viewers for being so patient and asking all the questions related to prostate. Please keep a note of all the important points. We'll see you all soon in the next session. Till then, you can follow us on our FB page. You'll find us by the name of Bladder Wellness. You can also follow us on Twitter, Instagram, and Facebook by the same name, that is Bladder Wellness. This is your host, Varsha Shrivastava, signing off. Thank you so much, everyone. And thank you so much, sir, once again.
Okay, Varsha. Thank you. Bye.